My name is Sriadithi Mamilla, and today I'll be presenting on molecules to medicine, microRNA interventions for global melanoma disparities. So to begin, here's a little bit about me. I'm a rising junior at Appomattox High School in Middletown, Delaware, USA, and this is my first year participating in the Global Health Leaders Conference at Johns Hopkins University. Extracurriculars I'm involved in are competing in HOSA, being vice president for my school's Business Professionals of America chapter, Red Cross Club president at my school, and regional executive board member, a volunteer in the Moore Children's Hospital, and an Indian classical dancer. In terms of research, I've conducted a literature review on the role of mRNAs in targeting the PI3K AKT signaling pathway in melanoma, which is what my presentation will be exploring. In the future, I'm interested in oncology, pediatric anesthesiology, or healthcare policy, with a focus on global health systems and bioethics. To begin with, what is melanoma? Melanoma is the most aggressive and dangerous form of skin cancer, and there's four main types. The first is superficial spreading melanoma, which is the most common. Then there's nodular melanoma, which as it sounds is shaped like a node. Then there's lentigo maligna melanoma, usually in older people with long-term sun damage. And also acrolentiginous melanoma, which is least common overall but disproportionately affects people of Asian and African descent. Melanoma is consistently a growing global health concern. In 2022, there are about 330,000 new cases and about 60,000 deaths. And this is expected to increase to 510,000 new cases and 96,000 deaths by 2040. And this bar graph really helps visualize how much the incidence and mortality rates are rising globally. But this story isn't just about numbers, it's about disparities. Melanoma is most common in countries like Australia, the United States, and European high-income countries, especially among Caucasians. For example, Nordic countries, or European countries, have 5-year survival rates as high as 95 to 97%. But in Asia and Africa, although incidence is significantly lower, mortality is disproportionately high. In fact, Asia has a 27% higher melanoma mortality rate compared to global averages. As you can see in the bar graph below, the mortality to incidence ratio in Africa is around 0.67, while in Australia this number is under 0.08. That shows that people in lower income countries are far more likely to die from melanoma when diagnosed. This raises an important question. What treatments are currently available and are they accessible globally? Standard treatments include surgery, radiation therapy, chemotherapy, or immunotherapy drugs like nivolumab. These methods can be effective but have serious downsides. For one, there could be severe side effects to treatment, as with any cancer, but one specific to melanoma is systemic toxicity. They're also very expensive, which is also typical for cancer treatment. For melanoma, some treatments may cost upwards of $56,000, depending on how far the melanoma has progressed. Additionally, they're largely inaccessible in low and middle income countries, particularly across Asia and Africa. That brings us to a more targeted and scalable alternatives, microRNAs or mRNAs. mRNAs are small RNA molecules that can regulate gene expression by binding to messenger RNA in a cell's cytoplasm. In types of melanoma specifically, they can be used to target various signaling pathways, for example, the PI3K AKT pathway. This pathway is often dysregulated, frequently due to loss of PTEN, a tumor suppressive gene, which occurs in 10 to 30% of cutaneous melanomas. And studies in mice have shown that targeted therapy such as this can reduce tumor growth by up to 60% in lung and breast cancers, proving its viability in melanoma treatments as well. Here is a simplified diagram. You can see that MIR7 inhibiting the EGFR oncogene and the MIR21 restoring PTEN levels, which will help deactivate the AKT pathway that supports tumor survival. But new therapies also raise new questions. Who gets access to these treatments first? Are diverse populations represented in clinical trials? Will low-resource countries be left behind again? These aren't just scientific issues, they're ethical ones. These ethical questions highlight why scalable and effective options like mRNA-based therapies are so promising. To begin with, literature shows that certain mRNAs can effectively silence oncogenes like BRAF or EGFR. For example, MIR7 has been shown in preclinical studies to restore its own levels, inhibit EGFR, and even overcome resistance to BRAF inhibitors as shown in the picture below. These therapies also show lower toxicity, which is proven by the significantly lower discontinuation rates in targeted therapies. For example, 53% of patients discontinue traditional treatment in the United States, while in a clinical trial with targeted therapies, only one patient had to discontinue. Furthermore, this solution may allow for low-cost production that can be scaled globally, addressing the inequalities. However, there are challenges as with any innovation. For one, human clinical trials are still limited today, and there's also high regulatory barriers, such as with the FDA. Access is typically always a concern. Even with low production costs, large pharmaceutical companies, such as Amgen or Sun Pharma, may still price them the same as current drugs due to their value. And trial diversity is always a major issue as well. Most trials are conducted in the United States and regulated by the FDA, meaning African and Asian populations who need it the most aren't well represented. Despite the challenges, the global impact could still be significant. mRNA therapies could reduce mortality, especially in regions like Asia and Africa. Even countries like Australia with high survival rates could benefit from this treatment strategy due to high UV exposure in that area. This could shift the melanoma model from costly, late-stage care to early targeted interventions, balancing current inequities. Still, innovation must go hand in hand with ethical safeguards. Without careful planning, these therapies could in fact deepen existing healthcare divides. That's why it's critical to ensure diverse clinical trial groups, fair pricing models, and adequate infrastructure to deliver treatments equitably. So, what needs to happen in the future? Well, for one, high-income countries with high incidence rates should focus on investing in globally inclusive clinical trials. Also, public and private partnerships could help distribute these treatments more fairly. For example, private companies like Pfizer or Myrna Therapeutics Inc. could begin and strengthen partnerships with Asian African government health agencies. Policy framework should also aim to align with the UN Sustainable Development Goals, like SDG 3, which stands for good health, and SDG 10, which represents reduced inequalities. We must tailor these policies by region to region to ensure truly equitable access. And finally, it's up to you, the future scientists, doctors, and policymakers, like all of us here, to make sure innovation is matched with access. So, to wrap it up with some key takeaways, melanoma cases are rising globally, and mortality is everlastingly uneven. Current treatments are costly and hard to access. However, new innovations like mRNA therapies target specific signaling pathways in melanoma and show very significant promise. But innovation like these means nothing without equity and ethics. So together, let's push for science and innovation that serves everyone. Here are my references for my websites, as well as images. And for my acknowledgements, I'd like to extend a very big thanks to my research mentors, the STEM Medic nonprofit organization which allowed me to conduct my literature review that inspired today's presentation, my parents, and the Global Health Leaders Conference team at Johns Hopkins for this incredible opportunity. Thank you so much to my audience for listening, and here's my contact information if you have any questions or want to connect.